Hello everyone, I am Dr. Unnati Mamtora from Progenesis Fertility Center, and today we are going to discuss about a complete guide in IVF injections. So why do we need to take injections in IVF? So basically, what happens in the natural cycle? There's only one follicle which develops in either of the ovary, and when this follicle starts growing and it becomes 18 to 22 millimeter in size, this follicle is called as a dominant follicle. This follicle then ruptures and it releases the egg inside your tummy. When you keep intercourse, that time the sperms which are released in the vagina start traveling up and reach the fallopian tube. Few of the sperms reach the fallopian tube and one sperm finally fertilizes the egg and forms the embryo. So if we want to do IVF, we need to take this egg out of the tummy. So how is this done? This egg is taken out in the form of egg retrieval procedure, which is done under anesthesia. A needle which is attached to the sonography probe goes through the vagina, and from that it punctures the ovary, sucks the fluid out which contains the egg. So when we are stimulating the ovaries, why do we need to stimulate the ovaries? So in a natural cycle, there is only one egg which is formed, and we cannot keep repeating this procedure for every time and take only one egg out. So basically, why are we giving injections? So the hormones which are produced naturally in the body are given in the form of injections from outside to form maximum number of follicles. So in either of the ovaries, whichever follicles are there, maximum number of follicles will be formed, maximum number of eggs can be retrieved, and when maximum number of eggs are retrieved, we get maximum number of embryos. Hence, this will give us a chance for better selection. When we have multiple embryos, when we can select the best embryo and then put it back into the uterus, giving us the best success rate. Also, what happens is, if there are more embryos formed, we can freeze these embryos by a technology which is called as vitrification. Vitrification is basically where embryos are frozen at minus 196 degrees centigrade, and they can be frozen for years together. So hence, if you have extra embryos and we have frozen them, we can use them as a backup. After 2 years, when you want a second child, you can always use these stored embryos in the bank and you don't need a repeat IVF. So this is why we use injections. Basically, one is to stimulate the ovaries. Second one is to prevent premature ovulation. The second injection which is added during the IVF stimulation is basically to prevent this rupture of the follicle happening naturally inside the body. Third are your trigger injections, which I'll be explaining you when I explain you how the injections are taken during an IVF cycle. And the fourth one is the intramuscular progesterone injections, which you take later after the embryo transfer or just before your transfer as a support for progesterone to support the embryo during the embryo development and to decrease the miscarriage chances. So this is the brief of why IVF injections are required. So how to take these injections? So these injections are typically started on day 2 of the period. You are called for sonography. We do a transvaginal sonography on day 2 of your period, and we decide the dose of the injection according to the findings in the sonography. So antral follicle count, the age of the patient, and the weight of the patient is going to decide the dose of what injection which we are going to give. Now, these injections are typically taken continuously for 10 to 11 days. So we initially give for 4 days, then we call the patient again for sonography on the 6th day, 8th day and the 10th day alternately. Now in this, when the follicle crosses 14 millimeter, we don't want the follicles to rupture. So a second injection, which is an antagonist injection, is added to prevent the rupture of the follicle. Finally, when your follicles become 18 to 22 millimeter in size, they are ready. So when they get ready, we decide to give a trigger injection. This trigger injection is usually given in the night, and the egg retrieval is planned on the day after in the morning hours. So according to the trigger injection and the OPU date, these are the two things which are fixed. So you have to follow the timing which is given to you specifically, because we want to not have the eggs ruptured in the tummy. So here, what is important is the time is fixed for the trigger. The trigger injection is to be a specific injection. Whatever time the doctor has told to take the trigger injection, you have to take the injection at that particular time only, because that decides the egg retrieval procedure time, which is going to be fixed according to your plan on the day of the retrieval. These injections which you take are self-administrable injections also, and they can be taken in the clinic. So you can decide whether you want to take it on your own, or you want to take it in the clinic where you're taking the treatment, or you want to take it in the clinic which is nearby your home. Basically, these injections need to be stored at a specific temperature, which is between 2 to 8 degrees centigrade, to maintain their efficacy. So during your course of injections, you have to ensure that your injections don't lose their efficacy. The temperature needs to be maintained between 2 to 8 degrees centigrade. We go to the next question, which is commonly asked during IVF injections, is what are the types of injections? So the types of injections are commonly, basically we have recombinant injections and we have the highly purified ones. These injections can be taken subcutaneously. The other type of injections are the urinary preparations, which were available initially, which are intramuscularly available. So you can take these injections either subcutaneously or intramuscularly. Now, these recombinant injections are the ones which are a little expensive. However, since they are subcutaneous injections, these injections are easily administrable. You can take it on your own. Also, they give you less pain. So these are the benefits of the recombinant preparations. Apart from that, they have a marginal edge of creating better quality eggs and better embryos, which can give us marginal better success rates of pregnancy. So what are the benefits of taking IVF injections? So in the benefits of IVF injection, the first benefit is that we are stimulating the ovaries and we are creating more number of eggs. Since we are creating more number of eggs, we are creating more number of embryos, and we create more number of embryos, we have a better chance of selecting the best embryo. We select the best embryo and we put it into the cavity of the uterus, it increases our chances of pregnancy. Also, if we have more embryos, these embryos can be frozen in liquid nitrogen. They can be stored for years together. So when we are storing the embryos for years together, we can have a chance of a second child later. When you want to come back, you may not require to do an IVF cycle again. So the benefit of this is having extra embryos at our hand. However, this is always individualized. It will depend on the age of the patient and your ovarian reserve. So this guidance can be given only by your fertility doctor once you go to a fertility clinic. Now, what are the side effects of the IVF injections? The side effects of IVF injections include weight gain, breast tenderness, bloating, nausea. Very rarely, it can cause OHSS. OHSS is basically ovarian hyperstimulation syndrome. The chances of ovarian hyperstimulation syndrome have now decreased by the advanced injections which we have, which is the DECA trigger, which we give the GnRH trigger, which reduces the chances of OHSS drastically. However, if you feel shortness of breath, weight gain, too much of nausea, uncomfortable in the tummy, you should always feel free to contact your doctor during your IVF stimulation. So what are the tips that I would like to give you if you are on IVF injections? Basically, hydrate yourself well. Second is store your injections properly between 2 to 8 degrees centigrade, which is in the door of the fridge. Whenever you go from hospital to home, home to hospital, carry it along with an ice pack. Thirdly, what is important is that take these injections on time as it has been instructed by your doctor. If you have queries regarding this topic or regarding IVF, you can always get in touch with us. Please comment in the comment section below. Thank you.